Bismillah Rahman Rahim. First of all, I am very thankful to the organizer for giving me this opportunity to share my views on the subject. I am Professor Dr. Iqbal Afridi, the Dean of the College of Physician and Surgeon of Pakistan. Hello everyone. Bismillah Rahman Rahim. I am Professor Dr. Iqbal Afridi, the Dean of the College of Physician and Surgeon of Pakistan. First of all, I am very thankful to all of you and especially the organizer for giving me this opportunity to talk about e-mental health, local solution to global issue, a developing country perspective during COVID-19. I have to disclose nothing and no financial benefit from anything. If you look at this slide, that the traditional health delivery system was that the patient was used to come to the hospital or the therapist, but in the e-mental health or telemedicine, information moves instead of the patient. So that means we have to reach at the doorstep of the patient where they live, where they study, where they work. So if you look at this, the existing health care delivery system in low and middle income countries like Pakistan, here you can say there are inverted triangles, that the population, where the population is 80%, the resources or expenditure is 10%. And on the other hand, where the population is 2%, the 50% of the resources or expenditures are given to that area. So therefore, we have to change this phenomena, that the resources should be available to the maximum population. Here you can see that 70% of our populations are residing in rural area in Pakistan, India, Bangladesh, and Afghanistan, and only around 30% of people live in the urban area, where most of the mental health services and all health facilities are available there, instead of reaching to the common man at the rural area. And here the living standard, you can imagine that there is a lack of resources and even the basic need of the life. If you look at this slide, that the mental health services, how they evolved during the last century, that the mental asylum was removed with the process of deinstitutionalization, and then it reached to teaching hospital, and the process of decentralization, the services reach at the general hospital, and with destigmatization, we have to reach at the community level, and even one step above that, we have to go about the tele-psychiatry or tele-mental health, a step ahead to reach at the people where they reside. Even we can go at the drawing room of the patient and the bedrooms as well to discuss their problem. So e-mental health is really a hope. So basically the term e-mental health refer to the use of internet and related electronic communication and technology to deliver mental health information, services, and care. And various e-mental health applications are developed, like instant messaging or video counseling service, telehealth, telemedicine or telepsychiatry, and consumer information portal, online support for groups, forums, and social network, and online assessment and diagnostic tool, etc. And importantly, teaching and training during pandemic, especially like COVID-19. In short, it means to transform delivery of mental health services and making them available at the place where the people are living, studying, or working through the use of information and communication technology. I have written an editorial, and this was published in JPMA, the Journal of Pakistan Medical Association, in June 2000 13. And here you can say the mental mental and behavioral health implication in local context, a hope to meet the need of the underserved. Local is a term which means combining the global and local. So therefore, we have to use the technology and other developing processes from the global area, but tailoring it to the local reality, ground reality. So therefore, we have to implication in local context. Uh, so with this keeping in mind, we when I was working in JPMC, we have developed the first telemental health pilot project for Sindh, and you can see that what we did, that we had intact with the peripheral area. And here a patient who was under the treatment of faith healers, and we revealed that he had a brain tumor, a large brain tumor, and he was referred to our hospital at JPMC and operated successfully. Otherwise, if the mental health or telemedicine was not available at that time, so we could have lost this young boy. So the outline of Pakistan we proposed that there should be Pakistan National Telepsychiatry and e-mental health that will extend globally, especially in the developing countries. And I suggested that e-mental health should be to have two components. One is the purely the mental health component to promote mental health awareness, destigmatization, education at school, college level, and in jail, and prevention of disorders, screening all spectrum of age and walk of life. And there should be webinar to educate and destigmatize mental health professionals, mental health patients, and illnesses. And the other component should be telepsychiatry, or which should include early detection and prompt treatment in non-pharmacological as well as pharmacological intervention, with the reduction of disability and also with rehabilitation. So if you so these things can be done easily if we promote mental health, and we can easily prevent a lot of psychiatric disorder and mental health illnesses. That we have to promote individual lifestyle in the form of improving ABC affect behavior, cognition, and also then promoting hygiene and a healthy lifestyle like proper sleep, work, exercise, proper diet, and use of leisure, and also avoiding alcohol and other substance. And importantly, rational utilization of mobile, computer, and electronic. And collectively, if we improve interpersonal relationship, we can prevent a lot of diseases. So telemental health, the ethical, but there are ethical issue as well. For example, and legal issue can have, for example, ethically, the doctor-patient relationship constant can be a problem, and social culture issue like a patient-doctor boundary violation, or for example, if somebody is calling from their bedroom, so therefore these can be in the form of problem due to gender issue, age issue, and sexual intimacy. And recording the communication can be another ethical problem, and fee and cost and reimbursement can also be a problem. Legally, we can have an issue of prescription in a distinct country or distinct place where the rules and regulation of medical prescription can be a problem, and side effect and management of urgency issues. And there another problem can be in the form of application of law of the country and so on. So now coming to the pandemic of COVID-19, in disaster, the size of psychological footprint greatly exceed the size of medical footprint. That means the impact of psychological or mental health issues are far greater as compared to physical footprint. And this is because that the potential concern of person during COVID-19 can be that the person there is a stigma associated with COVID-19. Like in Pakistan, there were people who were totally against the COVID-19 information. They were thinking that these are the not in real sense, and they are either created by the biological in the form of biological weapon by the people. And there were also problem that the social media and mental health issue and social distances and home isolation, loneliness, and there were lack of family support, anxiety, lack of clinic appointments. These all have led to gravity of the mental health problems. The psychological and behavioral response to pandemic can be in the form of either distress reaction like sleep disturbance and physical symptom, or and it can be in the form of psychiatric disorder like depression, post-traumatic stress disorder, anxiety, and so on. And health risk issue can be in the form of alcohol, tobacco, and substance use, family distress. And but there we can develop resilience among these people. So I will show you in the next slide that what we did for that. So the mental health response to COVID-19 in low and middle income countries were different. And in Pakistan, you can see there were 300,610 community members to provide mental health services for people, and there are hardly 600 psychiatrists in Pakistan for a country of 222 million people. So therefore, the gravity of the psychiatric services was need to be addressed in these countries. In Pakistan, when the first virus was confirmed on 26th February 2020, then we have lost around 30,000 deaths. And but since the media was showing just the death component and not the recovered people, for example, 98% of the people were recovered from this condition, but therefore people were having severe phobia, which I termed as a coronaphobia. And therefore they were using repeatedly the test and the health facility. So therefore, I was the president of Pakistan Psychiatric Society, immediate past president. So I wrote, I have Pakistan Psychiatric Society recommended and wrote a letter to the policymaker, Prime Minister, Chairman, the National Disaster Management Authority, and other people, Chief Minister, that what should they do? Because at that time there was no vaccination, there was no treatment. So we recommended that behavioral vaccination should be applied. The behavioral vaccination means using mask and maintaining physical distance. And there was also another thing that they were repeatedly saying that the social distance. We were totally against that terminology, and we suggested that there should be physical distance and social connectedness. So therefore, we recommended this, that what the government should do, the policymaker do. And we also wrote a letter to the WPA president, Professor Helen Herman, that there is a specific population in the prison. We should also take care of that. So the B.P.S call for safeguard of mentally ill prisoners amid COVID-19 pandemic, that is also covered by the media. And then we also develop a guideline, that means psychosocial support for healthcare workers during COVID-19 pandemic in Pakistan. And we suggested that the pandemic are associated with adverse mental health outcome, and both during and after. So we have to take care of, be prepared for that. And we also recommended that how we can have psychosocial intervention, the information, basic need of the people. Then there were a lot of problem because of the healthcare professional. They were having severe phobia, and also their family were reluctant to allow their medical professionals to work, their relative to work in the hospital where there's a high prevalence of the COVID-19. So we did a COVID-19 psychosocial support for healthcare professional arranged at the platform of Pakistan Psychiatric Society. So where we included people like nurses, doctor, ambulance worker, and so on, to how they should have sufficient information and how to protect themselves. And then on the World Health Day, we also had a seminar to thank the medical professional because they were the real hero. And at individual level, we developed this thing that the people, for the sake of the safety, should avoid shaking hand or also hugging each other. And then there was we also developed the how that people should have hand hygiene in the local context, the local psychosocial aspect, also putting the religious aspect in that. So therefore, we developed this thing that two things we could, because people were using hand washing and a lot of water wastage was done, that was also leading to problem to sewerage. So therefore we developed this, that before embarking on the hand washing, you should have clear mind and mindfulness, keeping in mind attention, intention, attitude, and also avoiding wastage of water. So therefore, after so in the meantime, you have to stop the water so that wastage can be stopped. Then we, in order to reduce the number of psychiatric patient visit to our hospital or OPDs, there were around, on average, we had more than 400 patients in one single OPD. So what we did, we developed a tele-psychiatry, that happiness.care, so that people can have services at their houses. And it was a digital consultation with psychiatrists or psychologists, and this was free of cost. But unfortunately, in Pakistan, since there is a poor literacy rate, so people were not able to avail this facility. So what we did, we had a mental health helpline, so that people can discuss their anxiety, and we ask them, if you have some problem in the form of anxiety phobia, you can contact psychologists and psychiatrists, free universal phone number. And then also we developed that how people should develop resilience, and how to tackle the COVID-19, the mental health and resilience in local language. This was the on one aspect. Since I was the dean at the College of Physician and Surgeon of Pakistan, as well as the JNA Postgraduate Medical Center and JNA Sindh Medical University, so all the teaching training were seized. So what I did, I started e-mental health teaching and training program for the students who were doing F.C.P.S, M.D. and M.C.P.S. And we developed a 1 hour teaching program each week. 1 week we invited local speaker, one from abroad, and that was divided into 6 components. That what are the objective for 5 minutes, then pre-assessment, BCQ for 5 minutes, then lecture for 30 minutes, and then a skill, how to elicit, for example, how to elicit a person's psychosocial history or psychosexual history, or to assess a person having somatoform disorder. That was also followed by question answer session and post assessment, and that was a very successful. And we around 50 webinar were conducted, and you can see that one of them, the second topic, was touch deprivation as a consequence of COVID-19, was given by Professor Asim Shah from USA Baylor College of Medicine. And you can also see that supporting emotional well-being of children and family during COVID-19 was given by Professor Waqar Azim from Qatar. So, There was also topic like mental health and climate changes, and the speaker was the Professor Khalid Mufti, and so on. There were a lot of people who did contributed a lot. And at the same time, we also contributed to the global study on this pandemic, the COVID, and this was the major study conducted in 155 countries, and around 170,000 people participated in that. And we promoted this in the and translated in the local language Urdu so that people can participate fully in the collaborative outcome study on health and function during infection time. And we also, I'm one of the author. So one of the paper was published in Journal of Affective Disorder, and one of the paper on the children was also published later on. Now coming to the last component, that although there were a lot of, we lost a lot of life, there was a lot of turmoil as a result of pandemic, but there are some positive aspect of COVID-19. That is 30% improvement in the pollution, decreases air travel, and there was a development of holistic thinking of the world, like taking care of each other at individual and country level, because there was one virus that traveled from Wuhan and spread throughout the life. So therefore, throughout the world. So therefore, we have to take care of each other, and we have to think globally and act locally. And we should think that people, the developed countries, should also contribute to enhance the quality of life at the low and middle income country, so that we can abolish the inequity of health. And therefore, another positive aspect of COVID-19 was the usage of electronic technology like Zoom and other things. These were the thing. And we learned a lot that protection is not to spend on the war, weapons, or atomic bomb, but investing on health and education is important, so that we could prevent, or at least detect, or predict that these things can happen. So therefore, the world should be prepared for any pandemic, which can we can lose a lot of lives. So with this, and lastly, being the chief editor of this Journal of Pakistan Psychiatric Society, we have published that that how Pakistan punched the corona and the COVID-19. With this, I'll end my talk, and with this message that we have to globally think and take care of each other as well as each other country, so that the inequity of the health can be abolished, especially of the mental health. And we have to spend on health and education, so that we can prevent such or predict such pandemics in future. Thank you very much. Jazakallah khair.